Go.
All right, we're going to be performing catheter care. This happens to be a male resident. And with every skill we do, we always start by knocking before we enter the room. We're going to identify and greet the resident, explain the procedure, perform hand hygiene, and then we're going to provide for privacy, whether that's a curtain or shut the door. All right. First thing first, we need to raise these side rails. You'll help me on that. Now this is a critical step. We have to raise the side rails before we raise the bed up to a position that is best ergonomically so that the resident cannot fall and get harmed. Once we get them to a position that is high enough for us, I'm going to put the bed rail down only on the side I'm working on, and I'll leave the farthest bed rail intact. So now that I've lowered the side rail, I want to make sure that my resident is in good supine position. And then I'm going to fan fold the covers all the way down to the end of the bed. And now I can drape my resident for the procedure. So basically, we're taking our cover here. This is a bath blanket. I'm going to take this bath blanket and I'm going to put it kind of in a diamond shape on the resident. So I'm just kind of unfolding this because we know we never shake the linens. So I just unfold this. I'm going to make sure that there is a corner down at the end. There's a corner on this side. Corner on the far side, and I'm going to fold this corner down so that it does not cover up my resident. So now I have them good and draped, and I am ready to put on my disposable gloves. So again, disposable gloves, you'll notice, are a critical step. So any critical step, we know if we miss that step, then we will automatically fail the skill. So once I have my disposable gloves on, I'm going to put on a bed protector. This is a waterproof pad to keep my linens from getting dirty or wet. I make sure that the waterproof side is down and that the cotton absorb side is next to the body. And again, I'm going to roll the resident back over towards me so I can unroll the rest of this pad. Good. So now we are ready for our skill. The first thing I need to do is expose the perineal area. I want to keep them as covered as possible with the rest of this blanket to help with privacy. So for a male, we are going to retract the foreskin. We cannot do this on a mannequin, but if you have a male who is uncircumcised, again, you're just going to pull back the foreskin before we clean the area. Once I do that, I want to make sure there's no abnormalities. Is there any redness? Is there any crusting? Any odd drainage? Okay, because we're always using our assessment skills. Once I have determined that it's fine, then I will be able to wash around that area with soapy water, okay? So I'm going to wash around the catheter, and then again, I can always use a different part of my rag each time to clean until I get a clean rag. You know, there's nothing else to clean. Once I have done that, I want to now hold the catheter at right where it meets the meatus. And I'm going to clean the catheter starting at the meatus and go out 4 inches. Okay, and that's just a guesstimate. Because again, we want germs to go away from the bladder. Once we have cleaned that, I will repeat as necessary. Then I'll take a rinse cloth with just water only, rinse that off, get a towel to dry the area. And then I'm going to make sure that this catheter is secured. So you're going to notice on the inside of the thigh, I have a way to secure this catheter so it does not come off. And that's not working for me, so I'm gonna go down a little further here. Okay. Secure the catheter so it can't come off. Then I'm going to coil the tubing. This will make sure that the urine drains out properly. And of course, and again, this is adjustable because I really probably want this down further. I'm going to secure this to the bed sheets to keep that in place. Once I've done that, I can remove the bed protector. And again, I roll it, keeping the germs on the inside. Okay, I'll roll him back the other way. Get this out. I'll put this in my soiled linen bag. And then I'm ready to remove and discard my gloves. Now I can cover them back up and remove the bath blanket. I'm going to make sure they're comfortable. This goes in my soiled laundry. And I'm ready to raise the side rail and put them back down. Okay. I've already made sure that my catheter bag is secured down here. It's hanging on the bed frame, because we hang on the bed frame, not the bed rail. I'm putting the bed all the way back down. Once it's back down, I will put both side rails down. Make sure that they have a call light, provide hand hygiene, and report and record. And that's the catheter care skill.